Hello and welcome to Infocus. I'm Bradley Valenaki. Now, there's been many comments from the public on vaccination, the work of the vaccine, especially in the time of the COVID-19 pandemic. Many myths circulating out there, and also we've seen in the recent past many of our doctors here in Papua New Guinea coming out and dispelling some of these myths. So, what is the job of the vaccines? And on the program today, I'm privileged to have with me Dr. Ananda Amarasinghe from WHO Regional Office. I'm privileged to have him with me in the studio. Doctor, welcome to the program.
Thank you very much.
Doctor, now, before arriving in Papua New Guinea, you have been traveling the region, of course, doing the important work of WHO. Comparing that work and looking at how we're faring with things here in Papua New Guinea, your experience basically.
Thank you. Well, I think you all know this COVID-19 pandemic is affected whole world. It's affected all big developed countries, developing countries. So Papua New Guinea is no exception. You can see this pandemic in certain countries started very early and it's gone very high level, very high numbers. Then certain points it dropped. Then again it came in certain countries. So this is what we call that, you have seen that they call first wave, second wave, and we are actually like in some countries third wave. But why, somebody might ask, why time to time you are getting that one? Because the countries have adopted very strict measures to prevent and control, like lockdowns. You have seen that it's a historically very something very unusual way that we are handling. So then people are not allowed to travel. International travel almost nearly shut down, nearly, I would say sometimes. So with that ones, they manage to control to certain level, but you cannot keep like that one, because we have to understand, in one hand, COVID is a deadly disease threatening to our life. But meantime, we have to understand that COVID pandemic has immensely affected to our day-to-day life. Schools are closed, some places, some countries completely closed schools for months. Economy is down, tourism has gone, business have gone down, shops gone. So people are having a lot of economic constraints also. So we have to move. And this pandemic is so rapid and very nasty. But meantime, as a global human team, we will fight and we will win somehow. But we have to adapt, we have to practice global practices. So in PNG, we have seen at the beginning, very few cases, good measures the country started. We appreciate it. The government of Philippines has taken a very appropriate, timely actions. That's why you let's. However, we know that it is impossible it is impossible for a country to completely shut down from the world. So like that, so we have to do a limited, the exchange. So therefore, somehow the COVID virus entered to your country also. So now you can see gradually increasing. So this is deadly, and especially this virus is very much, the people who are susceptible for this virus are people who are weak. The elderly, they are normally weak all the time, we know that. And that kind of people are more vulnerable, because there are certain things. Majority of people may get this disease, maybe very mild symptoms like a fever, cough, like that. But some number of people will move to a severe disease, hospitalized, and also deaths. As of now, the 15 million deaths.
So, Doctor, many of these people here in Papua New Guinea have been having doubts about COVID-19 vaccines, and I think it's important at this juncture to also go back and explain this to them. Some of the myths that have been circulating out there. Do these COVID-19 vaccines actually alter DNA? And the other one is, does it have some sort of magnetic pull that actually pulls magnet to the where the area of the injection has been administered. These are some of the myths that are circulating out there. Just clarify on that.
We see historically myths are going around for vaccine. This is not first time. Even the routine vaccines, your children are free from polio, your children are free from deadly measles today, no diphtheria in your country, no pertussis. So this kind of things you don't see today because of the vaccines. To control this deadly pandemic, the COVID vaccines available right now are the best option and most important option. Of course, I have to say, to control this disease, the best tool is vaccine. But however, don't forget the basic practice. You need to have a mask. Of course, now I am free from mask because here inside, but otherwise all the time, when you are in the public places, everywhere, you need to wear the mask properly. And also, please make sure that you keep the social distance, because this virus, we call the airborne disease or droplet disease, sorry. So it is drop there, so you need to be a bit distant from all the time as much as possible.
So doctor, going back to you touched on COVID-19 vaccines. Now, vaccines are not a cure. What do they actually do to the human body?
Yeah, very good question. The vaccine is a preventive tool. There are two things in illness when you are getting a disease. The one thing is you take measures before you get the disease. You prevent the disease. That is where the vaccine works. The cure is once you get the disease, so you have to treat the patients. So when come to the COVID-19, there are two ways. The first one is, I think the best one is to prevent it. That's the main thing. So vaccine is doing what vaccine's main function is to get preventive. So that is why we give vaccine to the healthy people for all the diseases, including the COVID-19, before they get the disease. If virus win, you are lost your life. So that's why you need a good nutrition, early going to the hospital, take a proper medical care. When it comes to the COVID, you go to the hospital, doctors will decide you what to do. They will give oxygen, they will give other therapies. That's all fine. But what vaccine does is they prevent you getting the disease. That is much more healthy, less risky, and it is good for your health and your precious life.
All right, so doctor, a very valid explanation there of the difference between COVID-19 and in terms of vaccination, and of course a cure when it comes to viruses. We'll go for a quick break and we'll come back on the other side with more of Infocus. Welcome back to the program. You're watching Infocus. Now, still on our discussions on vaccination. Doctor, we spoke briefly about vaccines, but we can go in depth on this one. People are asking how vaccination or vaccines actually, in terms of COVID-19, actually assist the body in fighting against diseases such as COVID-19.
Okay. So how vaccine works? It's a very complex one, but let me try to explain you very, very simple way. As I mentioned earlier, that this virus, we don't have definitive treatment. So what is happening when the virus come to our body? So our body try to start fighting with the virus. So normally our body try to develop so-called immunity. It's like a kind of defensive mechanism. In our body, there is a defensive mechanism. It's like in our country, Papua New Guinea, you have a defensive, you have your army, right? You have your navy, your air force to defend your country. Similarly, to defend your body, there is we call immunity system. It's work. So this immunity system fighting against the virus. If that immunity system then try to identify the virus features and they memorize and then they try to kill that virus. That is how it works. So how vaccine works? What we do is, before virus come to your body, we inject to your body the vaccine to develop that immunity. The mechanism is like this. That is why the vaccines have different way of working it there. There's a one kind of group of vaccines. How it's developed is that vaccine contain the killed virus. We call inactivated. That virus already inactivated. They cannot cause you any disease in your body. They are inactivated completely. However, when that vaccine is given to you, inactivated virus vaccine, the quickly our immunity, our defensive mechanism identified that, and they develop so-called the immune system. We call it antibodies. Antibody. The virus in our medical term we call antigen. It's a foreign body. So against the foreign body, our human body develop antibody to fight against. So when the virus come, we develop the antigen, our body develop the antibodies. So antibodies try to catch this one, kill this one. So what we are doing is before the virus, so then we are giving the vaccine now. Instead of the virus coming, vaccine comes similar like virus. Then our body will identify this vaccine, and our body memorize all these things, what we call the immunity. So now our body know how this virus looks like. So then now, next time now you are vaccinated, our body develop the immunity to face this one, memorize all these things. After some times, now the real virus come into your body now. When it's entered to your body, our body already memorized, they have the antibodies. They quickly identified this one and they destroy it.
All right. So in terms of the vaccines we have on the market now in the world, we've seen Pfizer, AstraZeneca, Sinopharm from the Chinese company, J&J, but in of course Moderna. In Papua New Guinea, the three commonly used or circulated vaccines in the country, how different are they in terms of one from another? Do they do the same job, or in terms of the anti-agents that the properties that they possess, are they different in the way they behave?
All vaccines have one common goal. They do one job end. That is, they allow your body to develop adequate amount of antibodies. That means all vaccines are aimed to develop adequate enough antibodies. That means a defensive mechanism in your body. That is the aim. But yes, different vaccines work differently, because I told you one vaccines, inactivated vaccines. So for example, in your country you have Sinopharm vaccines, which is inactivated. So it is a one we call platform. So whereas like AstraZeneca or J&J vaccines, they are having they are using a different platform, what we call adenovector virus. What they do is how they have developed is, from the virus, they have taken a small piece, and from that small piece, they have they modified it and entered to your body. So then what happened that our body detected that small piece. So then they know this is virus.
Doctor, another question that people would probably ask at this time is, which one is better, AstraZeneca, Johnson & Johnson, or Sinopharm from China?
What is the vaccine available at your clinic site, front of your door? That's the best vaccine. In different words, all vaccines are same.
True. And doctor, at this juncture, it's also important for all of us to actually know our health status as well. You're watching Infocus. We'll take a short break and come back with more of the discussions on the other side. Discussions on COVID-19 vaccines here on Infocus. Welcome back. Doctor, before the break, we spoke about the work of the vaccines. Now, work on the vaccines on human life, particularly those that women who are pregnant now or breastfeeding mothers. Is it safe for them to actually get the vaccines?
Let me explain you. The pregnancy is a physiological process. Pregnancy outcome is not always also favorable. You know that. That is the reality. The ladies in this country, they know. Sometimes the pregnancies at early stage, you end up with the abortions, unfortunately. Sometimes you will have a stillbirths, death babies. Sometimes you have a children with birth defects. So that kind of unfortunate things can happen. And even sometimes we know sometimes we are losing the mothers during the pregnancy. So that is the reality. Though it is a physiological process, so it is there. That's the one hand. The second thing I wanted to let you know about, when the vaccines develop, normally the pregnant women are not taken into the clinical trial for testing because of these situations. They avoid them. But what we know is sometimes once you are going to administer the vaccines in the mass campaigns, so we give to the women sometimes without knowledge that they are pregnant, they are taking like that. So historically we have seen for other vaccines. When vaccines given to the pregnant woman, it has no negative serious impacts. No negative. For example, measles vaccines we have seen, HPV vaccines we have seen, it is not happened. With that understanding, with the COVID-19 vaccines, we assume, because this is a new vaccine still, the COVID-19 vaccines are quite safer to the pregnant woman. However, we have very limited information about this safety data.
All right.
That we have to be open.
Of course. And doctor, at the same time, looking at the for pregnant mothers, it's a risky business we're talking about. It's high risk. So it's also like a person who has already some very strong underlying medical conditions as well. So of course we are expecting this to also happen. But vaccines, it's safe for women, pregnant women.
Yeah, that's what I'm trying to tell you. But some of the ladies, pregnant ladies, they are having sometimes diabetes. Some of these pregnant ladies they are having hypertension, increased blood pressure. So those kind of pregnant ladies, they have a more high risk of severe illness. The people who had the vaccination, your history of, irrespective of history of your vaccination, WHO recommend that we encourage you to get the vaccines, right, because it will reassure you that you are protected. So, but there is a gap you have to. So, as of now, we are saying you can, if you get the disease now, you can postpone for a few months, but not too longer.
So, speaking about the COVID-19 vaccines, look, other parts of the world are going for the third jab, which is the booster jab. Here in Papua New Guinea, that's not the case. Your opinion on that?
Normally for other vaccines, all vaccines we know historically, what we have to date, the booster doses are a normal thing. As I told you how vaccine work, remember I told you virus come, similarly vaccine come, our immunity, remember, it's a memories. So these memories over the time, it is waning, it is going down. So when the memories are going down, so you need to give a little booster to memories to protect, increase your things. You have to have your primary vaccination course. If it is AstraZeneca, if it is a Sinopharm, you must first take your 2 doses. Please take. If it's a J&J vaccine, please take your single dose. Once the country is having the substantial amount of population, say about 70% of population, when you are having your first dose, the primary serious course, then we can think of at that time. I think at this time, I kindly, sincerely request everybody, please focus to get the vaccine now. Booster, we can do it later. We are not saying no. We are saying can do, but later. But now, please focus to get your primary schedule. 2 doses of AstraZeneca, or 2 doses of Sinopharm, or 1 dose of J&J. The virus slowly now jumping to the children also. That is how exactly virus jump. Because once we are protecting the old age groups, virus want to survive. So virus will jump to the now children. So so far, the severity of the disease among the young children now compared to the old age groups are quite low. But however, we know the children are also susceptible. So therefore, we need one day to vaccinate them also. So however, when we compare to, as I said, their risk of severe disease is quite low compared to the elderly people. So one day, I agree, I accept that we have to vaccinate our children also. So yes, recently there are regulatory permission, authorization for some vaccines for even under 5 years. Up to 5 years, 5 to 11 years also. But still, it takes time. So other vaccines to registered and allowed to use for the children. It will come gradually. So, but again, come back to my first point. Let's focus our first target group now. That is the adults above 18 years and old. So we must first vaccinate them because they are the very high risk group. Once they are protected, we can. Of course, children are our most precious part. That is our lovely part in our life. We have to protect them. But what we are saying is we have to understand the reality of the virus. So far, I think the children are much more, I think, strong position against the virus. We will vaccinate them later. There's no disagreement. Again, what I told about like in booster dose, it's a matter of time. It's a matter of time. Let's go in the step by step. This is how all other world has done. All the developed countries, what you are referring now, US, European Union, Australia, all these countries, they have gradually gone. They have gone first to their healthcare workers. That's the number one they started, everybody. Second, they have gone to the susceptible elderly age groups, all the population about 60 years. Then they go to even the young age, 18 years to above, for all the people who are having the more comorbidities, like diabetes or anything. Then they said, okay, 18 and above. Then they go, okay, 14 years and above. Like, you see, it's a gradual. And also we have to understand the vaccine availability because this is a global demand now. We have limited supplies. And also I have to tell you, you are getting these vaccines free. Please best use it.
True. So, Doctor, we thank you very much for your time joining us on the program and explaining to us the importance of the vaccine and how it actually works in the human body. We appreciate your time with us on the program.
Thank you very much.
All right, this is Infocus. If you have comments on tonight's program, you can email us now on the email now showing on your screen, or you can engage with us on our social media pages. As always, stay safe and adapt to the new Plapasin, or the new Plapasin basically in Papua New Guinea. Stay safe. Bye-bye now.